1-year-old Abigail has never seen the world she was born into, but soon she will. She has had an operation to replace her corneas at the Moi Teaching and Referral Hospital because she was born blind. Her father says she has a definite chance to see.
Cornea ambayo ilifanyika ilitolewa kule ng'ambo, ambapo ni USA. Tulikuja mwezi wa 4, tukadani itafanyika haraka, lakini kwa sababu cornea iko imefika, kabidi tukawa patient. Lakini tunashukuru Mungu kwamba imefanyika.
Oscar Kipkoech dropped out of school when he lost his sight. He has been away from school for 2 years, but soon will resume studies after undergoing a cornea transplant.
Kwa hivyo ndo nimeendelea na matibabu hadi saa hizi ndo tulimanage kwenye transplant.
Okay.
Yeah.
So can you see, can you read? How do you feel after undergoing your transplant?
No, I'm okay. I can see and read. Hadi saa kula time fulani sasa sikuwa naweza ona mbali mtu aweze akasimama more than 10 meters na nimuone.
At the Moi Teaching and Referral Hospital, we meet Dr. James Bett, Kenya's pioneer ophthalmologist and physician behind cornea transplant in this facility. We began by asking him why cornea is an integral part of the human eye.
The jobs of the cornea are to transmit light into the eye and to focus light and images going into the eye. So focusing and transmitting. So it needs to be clear for it to transmit. Yeah? And it needs to be a certain shape for it to focus light.
So when can a doctor recommend cornea transplant for a patient?
If the cornea is damaged by infection or by injury, then it needs to be replaced. The other reason, if the shape, and that's the commonest reason we do cornea transplants at MTRH, if the shape is not correct, it is too curved, especially in a disease called keratoconus, then we need to remove it and replace it with a good, well-shaped cornea.
If a doctor recommends cornea transplant, you can only get one from another human, and perhaps that's where the rubber meets the road if you're in Kenya. Donors of cornea donate them posthumously.
The technology we have now, we cannot manufacture cornea. Yeah? So any cornea that will be used to replace a damaged or diseased or badly shaped cornea will be a fellow human cornea. For the cornea, anybody can donate to anybody. It can be borrowed from somebody who has passed away.
Can age be a factor if one was willing to donate their cornea when they die? Dr. Bett says it's the quality that matters instead. But the younger you are, the better the quality.
If I got a 7-10-year-old cornea, I would call it a perfect match for that young child. But still, getting 27-year-old, that's the youngest we've ever gotten. We consider ourselves lucky.
According to Dr. Bett, the demand of cornea replacement is exceptionally high at the MTRH. The challenge is compounded by the fact that they have to buy cornea tissues all the way from the United States of America, thanks to those who donate them posthumously.
Currently, over 99% of corneas used for transplant in Kenya is imported. Most often from USA. For us, we get almost 100% again from USA. Yet 20 bodies leave the mortuary every day. So you can imagine 40 being buried to be eaten by worms, and we are waiting for 2 weeks or 3 weeks for a cornea to come from USA. A poorer quality cornea to come from USA.
To put this into perspective, MTRH had a target of 10 operations for this financial year. 3 months later, they have undertaken 11 operations, which speaks to the dire need of cornea tissues in the country.
So there are so many people out there who need to be assisted. The question is, would you rather donate to a fellow human being, or are you more comfortable donating to the worms?
That is the million-dollar question, and a conversation as a country perhaps we need to have.
But are Kenyans ready to have a conversation around donation of body tissues like cornea when they die? Bet acknowledges the importance of enacting legal framework and structures to guide such an endeavor, like the creation of Kenya Tissue and Transplant Authority, but also reckons Kenyans have not been sensitized on this matter. The fear has always been around opening a window for some people to venture into the illegal business of trafficking human tissues.
I think the earlier we organize how to safely motivate people to have and then harvest from willing people, the better. The other thing is that as the cornea, we are on the deceased part. We are harvesting from dead people, dead, generous people.
We sought opinions of Kenyans on this subject.
Kama umeshakufa, umekufa na umeenda dunia nyingine. Sasa ikishatolewa itaenda kusaidia nini mtu mwingine?
Kwa Afrika itakuwa ngumu. Sababu wataona watu wengi watakuwa wanaweza uliwa. Watu wenye wako na pesa wanachukua hiyo advantage. Wanaenda wanalipa daktari. Daktari anafanya hivyo hata kama daktari anasema ati sitakubali ulete. Lakini kama sasa hata hawezi kubali utoe figo lakini inapatikananga. Nitakuwa hiyo ya macho.
It is good and possible if you've died or you know you want to die, you can write a will and help other people with the lens. How do we call it? Actually with the lens, so that they can use it because you are already dead. I feel it's an important matter.
Currently, you will need 300,000 to undergo the procedure, and MTRH remains the only public facility that offers this type of eye treatment. Timothy Simwa, K24 TV.